a full body scan necessarily, or would
No,
it be just?
not necessarily. I mean, it's the best baseline that you can get because, to capture everything that thermography can see would be a great thing to have because then you can have that to compare to over time. So if you do develop symptoms or you even wind up with an injury of some kind, then you'll have that region captured. So now you'll have something to compare to see what the severity is or if there's any other indications. So a lot of the challenge with medicine today is all the focus is on the symptom. Even cancer is a symptom.
Right.
Cancer is not the problem. Cancer isn't the bad guy.
Believe me,
It's the wake-up call, right? So most disease starts in the gut or the mouth, as we're seeing here. So when women come in, they just do the breast. It's almost it's actually a disservice because the breast isn't enough information. I mean, the thing that I've discovered being in thermography for over 20 years is that the breasts are like the canaries in the coal mine. So if something's going on in the breast, there's always something going on somewhere else in the body. It's undeniable. And the breasts are at the affect of everything else. So like I said, dental infections, 95 to 98% of women diagnosed with breast cancer had a tooth infection she didn't know she had or was neglecting. We can see the dental lymphatics and tell you have a tooth infection. We see gut health issues. We can see irritable bowel, leaky gut.
You can see the gut health issues with the thermography?
We're seeing that. We're seeing the inflammation and the indicators that the gut's in trouble. So look at, so she had leaky gut and irritable bowel, and she had severe liver toxicity. She even had a little extra inflammation on this side of the pelvic area than this. So these are important indicators for the basis and the foundation of your health to know if there's something going on in the gut, because that could be a root cause of any kind of disease, and especially tooth infections. I just recently talked to a patient who has a sinus cancer. Sinus cancer and a big tumor right here. Well, he has 2 failed root canals on the same side. And they were right on the margin of the sinus. And they were afraid to take them out or to do anything with them. But they could be the very cause of the sinus cancer or the failed root canals, 2 huge abscesses. So that's why these things are so important to see, because it gives us the indicators that you can't feel and no other device can see. That's the other challenge with this, is that by the time a mammogram can see something, it's 8 to 10 years into its growth, and it's over 4 billion cells. If you have any density in your breast, it's the same color as the cancer, so it could still get missed 75% of the time. So structural devices can only see late stage, because cancer cells are microscopic. Only a microscope can see microscopic cells.
Right.
We see the metabolic activity that's indicating there's a challenge in the tissue years before it becomes this, right?
Yeah.
So this shows you a woman, she was in her early 50s. Her breast was perfectly clear when she came in. She came back 3 months later for her comparative study, because in thermography our baseline is a comparative study, because that's what makes it preventive. We want to get a stability, establish stability in the tissue before we say go ahead, we'll see you in a year, because we're doing a disservice if there's all kinds of stuff going on in the breast and we have nothing to compare to. We can't tell you if that's a concern or not. It could be superficial veins, dilated veins, scar tissue, fibrocystic activity, and it could be pathological activity, which is what this is. So she's got all kinds of fibrocystic activity and inflammation. She's got some scar tissue. She was a dancer. She's got nothing else going on but that, and that's the blood supply that's leading to a tumor right here. We can't see the tumor, but we see the blood supply. No other device can see that. So she came back 3 months later, and we're starting to see the earliest development of a blood supply. And she was crying tears of gratitude that she was using thermography, because we were seeing the earliest possible indication.
So then what happens? Does she make lifestyle changes?
Immediately.
Yes.
Absolutely. Yeah, she had tremendous levels of stress going on, and her lifestyle wasn't the greatest. I mean, she needed to clean up her diet and maybe do some cleanses, and she had some deficiencies going on, so there's, and hormonal imbalance, and she was early 50s, she was going through menopause. She was starting she was perimenopausal and starting to go through menopause. So her hormones are off. Well, it's a perfect time for something like that to take hold, because if her lifestyle isn't supportive, she's got stress, her hormones are out of whack. I mean, that's going to throw the immune system off, because they work together. The hormone endocrine system works together with the hormone system, and they make sure each other is doing their job.